Deadline for applying for health insurance through the U.S. government's Affordable Care Act has just passed. Washington has been trying to reassure some 13 million foreign-born people without medical insurance that they can apply without fear of being deported. Ginger Vaughn reports from Texas, the state with the nation's highest rate of uninsured people.
Clara Rodriguez says it's been tough reassuring immigrant families that they won't risk deportation by applying for subsidized health insurance.
One of the issues that can arise is just confusion on whether or not you should apply, on whether or not you have the immigration status to apply. There's definitely a confusion. You do have to explain to them how to go about it and definitely talk to them. And talk to them not only about Marketplace, but just ease them into the process because they are scared to tell you.
Healthcare centers around the U.S. like this one are doing their best to make a difference.
While illegal immigrants can enroll in the new healthcare program, many of them come from so-called mixed status families who have at least one family member who is a U.S. citizen or a legal resident. Texas has the highest rate of uninsured, many who are from immigrant families.
Seeing that the parent, is unlawful resident, right? They wouldn't qualify, but the children do. So you do want to talk to them and say, this is respect for your children. You might want to look into it. You can't, force them or anything.
Since Washington launched the healthcare.gov website in October, advocacy groups and the federal officials have been trying to reassure immigrant families that the site won't share their personal information with law enforcement agencies.
The darker color represents a zip code that has between 6,000 and 10,000 uninsured targets.
Mario Castillo, who runs the Get Covered America publicity campaign in Texas, says educating immigrant communities is his priority.
If they are eligible, they're concerned about the cost. How much is this really going to cost me? Can I afford it? And then there's also sort of the privacy issue. If it's a mixed status household, where is this information going? What happens to someone who is not a citizen or has legal status?
The website now has a page that says family members who aren't applying for health coverage for themselves won't be asked if they have eligible immigration status. Despite obstacles like the technical issues that plagued healthcare.gov during its launch, advocates like Castillo and Rodriguez say their efforts are paying off. But more time is needed to reach the thousands of mixed status families here in Texas. Ginger Vaughn, CCTV.